Good afternoon, guys. So this is Dr. Joe Brown. What I want to do is I want to go over again not only a complete Cbc and Chem Panel, which is your blood work that your doctor usually does with you, but I also want to go over a urinalysis, and this is a urine test. So when you go in and you pee into a cup and they test your urine for different proteins and sugars and things of that nature, I want to go over that with you. And then, important, what I want to go over with you guys is that many times when you guys go in and get your blood work done, or your urinalysis done, or scans, or reports, or any of this stuff done with your physicians, you usually then follow back up within a couple weeks to go back into your doctor so that they can go through the results with you. And 99% of the time, they usually tell you everything's okay, and they never give you a copy of your blood work, and you end up leaving, and you go home, and your wife or your husband or your mom or somebody asks you, well, how was it today? And you say, well, the doctor told me everything was fine. And then months later, 6 months later, 3 months later, whatever it ends up being, usually people are diagnosed with a problem, and somebody, usually the next doctor, is saying, well, you had your blood work or your urinalysis done 3 months ago or 2 months ago. Why didn't you look at this stuff? Why didn't your doctor go over this stuff with you back then? And usually the patient tells me, well, they did, and they told me everything was fine. The reason why I'm doing this video is I'm going to actually go through every single analysis and laboratory that is on your blood work and your urinalysis so that you know what to look for, and you are going to be getting a paper copy each and every time to take home with you so that you can look at it at home. And so that way, if another doctor in the future asks you, do you have your blood work? You can say, yes, I read through it myself and I understand it. Okay, so let's actually go over both the Cbc Chem Panel, and then we're going to actually cover the complete urinalysis as well. All right, so we're going to actually take this in probably 3 different parts. So this is the complete blood count, also known as the Cbc. Then you have the comprehensive metabolic panel, which is the Chem Panel. And then in section 3 here, you have the complete urinalysis. And so this particular patient, so I've been lecturing over in Europe for about 6.5, 7 years. And so what I want to show you is not just what to look for under each of the panels. I want to make sure that you're looking at not just your result, but I want to make sure that you are reading your reference ranges of what they should be in, okay? And if you look down here, I ran this on a patient the 1st of February of 2020 at 5:34 p.m. Now, let's cover under the CBC what this means. So WBCs, this stands for white blood cells, okay? Then what we're going to do is we're going to break this down from red blood cells down to platelets, and then we're going to break this down to neutrophils, down to basophils. And I'm going to explain why I'm doing that here in 1 second. So let's just start for a second. WBCs, like I said, this stands for white blood cells. This particular patient's results were at 6.5. Now, always read the reference range. So the reference range should be between 4.5 to 10.0, okay? Now, I want to make sure that, because I do get questions from time to time on this, is that my reference range or my number is a different reference range or number than what you are showing. Why is that? Certain labs of the state or the country you live in will have different results and sometimes different reference ranges based on the lab that was being used when they ran your blood. That does not mean that your result or your reference range is right or wrong. It just means that the result that they are giving you fits within the reference range that they are using, okay? So the key to this is, so let's just start here. So the first part, this particular patient had a 6.5 white blood cell level. If you look over here at the range, this is what she should be in. 4.5 to 10.0. So she has essentially a standard normal white blood cell count, which is where I would probably say about 93 to 97% of people fall within this category. Now, the next couple things down on here, RBCs, this stands for red blood cells, hemoglobin, and hematocrit. When you go into your doctor and you are saying, I'm anemic, or I feel tired, or I feel fatigued, or after I eat lunch, I really have no energy and I'm drinking coffee and taking energy drinks and things of this nature, the doctor is usually going to be looking in this area here, especially at red blood cells, hemoglobin, and hematocrit. Now, let's look at these numbers. 3.9 was this patient's results. Range should be between 3.5 to 5.0. So not a average number, maybe even slightly lower than average, but still within the reference range. And before we get into the things that I wrote down here, if you look at the hemoglobin and hematocrit, this particular patient's was at 11.0 and then 35.1. Now look at the reference range, 12.0 to 16. So this particular patient was 1 point below what the reference range should be. Okay, and that's why out here, this area says flagged, and you will usually see a low, a high, or a critical low or a critical high number here. And this particular patient was slightly low because they were 1 point lower than this reference range. Hematocrit, 35.1 was this particular patient's results. And if you look at the reference range starts at 36.0 to 46.0. So again, lower than where we should be. And this is why you're seeing out here under the flagged area, we have two numbers that are lower than the reference range. Now, why am I pointing this out? Anybody can read low versus high, okay? The doctor, who usually has 100 patients and is spending probably 30 seconds on your lab results, usually doesn't cover any of this with you unless they are seeing something written out here in this flagged section. Okay, now if I only looked at this particular flagged section, I would say, well, patient A, you have a hemoglobin and hematocrit that is low, which means you're anemic, so I need to put you on iron or put you on different vitamin supplements to solve that problem. But that's not good enough, okay? And the reason why I wrote out here watch, and I put arrows next to different things, because this here, if you're anemic here, you need to watch your other red blood cell levels because this is already a little bit lower than what it should be. And if you look down here, MCV, this is mean corpuscular volume, MCH, mean corpuscular hemoglobin, etc. Down here to platelet count, you will notice that I wrote down in here watch as well on this number 28 and 31 results. Why? Because if you look over here at the results, this particular patient should be between 26 to 36, and they were literally 2 points above the border. And this number, 31, is literally on the border of being low. So this patient is not just showing anemic on these two levels, but this particular person is almost low on these, which means that we have more of a whole body problem going on than just an initial slight anemia with this particular patient. So I didn't just write this out because I want to watch this in the future, but specifically when I get the next set of blood results, which I'm going to actually go over with you here shortly, I'm going to show you what I wrote down here and then what I found on the next set of blood work that was done later. Obviously, let me just preface this. I've bended this piece of paper both on the top and the bottom so I can cover any patient's names, date of birth, all the pertinent information that I need to keep private with this patient, and as well as on the next lab I'm going to go over with you here. Okay, so, but you do see when this was done, 1st of February of this year and at what time, and then I will show you the next date of what we're looking for and when that was done. Okay, now that was what was the red blood cells down to the platelet count. Now if we come back up here for 1 second, white blood cells. On white blood cells, the white blood cells is your immune system. This is essentially like the umbrella that shows what is your overall immunity, keeping you from getting sick from viral infections, bacterial infections, and viral infections. The reason why I wrote this line or drew this line down here, starting from neutrophils down here to basophils, these are the different types of white blood cells that are critical for making sure you're not getting sick for doing, or when you get bacterial or viral infections or different things. So for example, neutrophils. If we see an increase in neutrophil count, this typically means that the person has a bacterial infection. Specifically, if the neutrophils are high and the lymphocytes are low. It's a particular ratio that It's the reason why doctors spend 4 years in medical school, because we are not just trained on what result to look at within what reference range, but the ratios of one thing to another. So if I see something going on up here and see something going on here, it's not just I have one number, two number, three numbers that are off, but I'm looking at certain ranges of what is off to show what kind of problem we could be having. Okay? Now in reverse of what I just said, if we have lymphocytes that are high and neutrophils that are low, this will tell us that the person has a viral infection. Okay? Monocytes, eosinophils, and basophils. Now, these three type of white blood cells, although very important and show us different things, can sometimes alter in very general cases, and then on the other side, sometimes very serious cases. So, monocytes, for example, basophils, these things can sometimes be altered. You ate something, you have allergies to something, something as simple as you were out mowing the yard, your eosinophils are high. But these can also start to elevate, with the special exception to monocytes and basophils, in something very severe such as a HIV, hepatitis C, AIDS virus, very chronic situations, or autoimmune conditions like lupus and different autoimmune conditions. Okay? So this was the CBC, or complete blood count level. Now we're going to talk about the comprehensive metabolic panel, also known as the Chem Panel. The Chem Panel, this starts with glucose, covers proteins, then we go down into ALT, AST, which are different enzymes. So again, I'm going to cover all of this with you. So this particular person, so I wrote down in here, this person was fasting. So in other words, they had not eaten from 6 to 8 hours previous to me taking this person's blood. And that's very important, because when you're looking at sugar levels, this glucose level is the glucose level that particular person has on that particular day. This person's level was at 85, and the regular range is 70 to 100. And I actually like to see this between 70 to about 90, 95 at the very, very most. This is actually a little bit higher than I'm comfortable with, to be honest, but still within the normal range. BUN, creatine, protein, albumin. These are different proteins that are being processed from your kidneys, from your liver. And so if you look at these, I've made marks next to some of these. And if you look down here, we're already starting to see a low number here, okay? And so, and some of these were on the ranges, just like I showed you here. So if you want to look at these numbers, and again, make sure you're checking the reference range numbers here. These numbers, I want to make sure we're watching, because they're a little bit lower than what I like to have them. Now, ALT, AST. These are really, really important. ALT is a liver enzyme, and AST overlaps into a liver enzyme as well as a heart enzyme. And this goes back to, if you're a doctor and you know what you're doing and you know what you're reading on labs, if your ALT is high, you usually have initial signs of liver problems. If your AST is high, it also means look for the liver, okay? And if you have numbers where your AST is high, but your ALT is normal, this can actually tell you that you need to look for concerns in relation to the heart, okay? So again, I'm not going to cover every single number and every single range value you can read. I'm just using this as an example for you, but here were the ranges. So if I look over here, ALT, we were at 44. The range is from 0 to 40. So we're actually 4 points high on this patient. But I will preference this particular patient who agreed to let me use her labs. She was pregnant. So, and that's the reason why I'm paying special attention to some of these marks, some of these numbers that are actually not elevated or not lowered. And for example, on the ALT level, if this was a general male or female in my office, I'd be saying, I think you're probably drinking too much, smoking too much, not exercising enough, or being exposed to chemicals. But because this is a particular patient that I've known for many, many years, and she is currently pregnant, her body is processing different things, much more now because she's pregnant and she has a baby. So this is actually higher than what it should be according to the reference range, but because she's pregnant, this is not something as of a concern with this particular patient. AST, okay, her number was 35, and this shows 0 to 40. So again, higher on that scale, but within the normal range. But again, let's watch that, okay? Alkaline phosphatase. Now this can also show liver problems or different conditions, bone disease, but this also elevates, just like platelets will elevate if somebody has a cancer condition or a serious chronic medical condition, okay? So it would take me hours to cover every single one of these in the different ratios of one to the other. But this is why it's very important to be doing a complete blood count as well as a Chem Panel and a CBC together with differential and platelets, because there are things that we will look at in this section and there are things that we will look at in this section. And there are things that we will look and compare from what's here and what's here together, okay? Total bilirubin, this lets us look at your gallbladder and how your gallbladder in relation to your liver is functioning. And then we come down into some of your electrolytes, calcium, sodium, potassium, chloride. These are certain minerals, calcium, sodium, and potassium, that are very critical for not just kidney function, but especially heart function, bone density, and things of this nature. So these are really something we want to pay very special attention to, okay? Your carbon dioxide. This is something that we can measure how much carbon dioxide is being found in your blood. And carbon dioxide, as you know, your body exhales as you're breathing in oxygen. So this is something that, again, depending on if this is too high or too low, we can actually determine certain medical conditions based off of your CO2, okay? Now, let's come down here to the next section, the complete urinalysis.